So there were a number of 324 cases locally acquired yesterday, reported of COVID-19, and there was one case in hotel quarantine. 107 of those cases are linked to known outbreaks and cases, and the rest are under active investigation. This takes us now to some 2,166 active cases, all except 5 of those are locally acquired. This continues to be an outbreak of the young and disproportionately the young and the unvaccinated, and the figures continue to reflect that. Some 317 cases are between the ages of 0 and 9. 337 cases are between the ages of 10 and 19. 556 cases are aged in their 20s and 365 in their 30s. 87% of all of the cases that are active in the state are aged under the age of 50. There are 111 people in hospital in Victoria. 32 of those are in intensive care and 19 of those are on a ventilator. There were 37,604 vaccines delivered through these state-run clinics yesterday, another impressive daily record for those state-run centres, and I want to thank those 37,604 Victorians, but equally the hard-working staff in those state vaccination centres. There were also 54,242 COVID-19 tests returned yesterday, and well into the high 90% of those were turned around within the next day. So of the 111 Victorians currently in hospital yesterday, 89% of them were not vaccinated at all. 11% were partially vaccinated with a single vaccine. And we had no one in hospital who had been fully vaccinated. I just wanted to touch on a particular case in an aged care facility in Gladstone Park. We were notified late yesterday of an aged care facility in Gladstone Park where the large majority of residents and staff have been tested, and in addition to the one case of a worker there, that no one else has yet returned a positive result. Pleasingly, some 90% of the residents at the facility are vaccinated, and even more pleasingly, 100% of the staff were vaccinated, including the positive case. It's really excellent to see that what works when that high coverage is in place. We've still got to run those tests down, but we all know only too well from 2020 what the impact of coronavirus can be in our aged care settings. And it's important, therefore, to remind anyone in the aged care sector that if you haven't been vaccinated, you need to do so, because it is now written into the public health orders that as of the 17th of September, vaccinations are required for all all aged care workers in regards to applying the National Cabinet decision from some months ago, a decision that all states and territories have supported and one which Victoria very strongly supports. In regards to the state's own aged care delivery services, the state residential aged care services, more than 90% of residents have had at least one dose, and those who have declined or have had people decline it for them, we continue to approach them to make sure that they have the safety and the protection of being vaccinated. Over 86% of the public sector aged care staff have also had their first dose, which they will need to have if they are to stay at work past the 17th. Victoria's public residential aged care services have been leading the way in delivering on the National Cabinet decision here, and many of our facilities have for some time hit 100% staff vaccination levels right across the state, from Apollo Bay, Beaufort, Birchip, Burwood, Camperdown, Lorne, Donald, Shepparton. From one end of the state to the other, the state residential aged care services have been leading the way. We've just got to mop up those last few, and now that it's in the public health orders and is required as a condition for coming to work, we're confident that that will make sure that that's mopped up. In regards to the entire, both public and private and not-for-profit residential aged care system in Victoria, it's pleasing to note that 82% of the workforce overall has had their first dose, and we would encourage the remaining sector, the remaining parts of the sector, to use the intervening period and the priority status that the workforce has to get vaccinated. It is so important.